you to kindly in just start putting your names in the chat box. What's happened to this? Okay, so I won't go through all of this because we've covered almost most of it. Um, we are generally talking about why effective communication is important in health and social care. So obviously, communication is a method through which you pass on your message. Okay, and why is it important? Your clear message is important because obviously there's a coding process and a decoding process. So whatever you say is then that information is then collected, and then it goes to the receiver, which is the patient. So there was the whole process where we went through how the communication process works. So there's a sender, like it's myself. I'm communicating to you, and I'm communicating a message to you, and you are the receiver. Okay, and we're doing it through an online session, and then I ask for feedback, which then makes me better um, in terms of my communication skills. So these were all the different ways where effect communication can be most effective. Okay, so I won't go into depth of these. We were on slide 10. We talked about all of this. So, okay, so now we are going to talk about what barriers we have in communication. Thank you for those who are starting adding their names. At the end of the session, please stay on for 1 or 2 minutes. I'll take a snapshot also of your attendance. So we have two sorts of evidence that you were present. This is very important for your when you're attending your sessions. Now we're going on to identify barriers to communication in health and social care. So Ali and Parida, they were two authors who identified certain major barriers um, during communication in health and social care. So what are those major, most important barriers? Condition of the service user. Okay, so what type, how is the service user? So the person who's taking that message. For instance, if you're giving a message to a child, it's difficult communicating with a child compared to communicating with an adult, because an adult understands what you mean. And if there's a if there's communicate if that person has some medical condition, is deaf or blind, for instance, in those in instances also it's hard to communicate, and you need certain sorts of training such as British Sign Language to be able to communicate with them. Competing demands. So, among health or social care or health and social care practitioners, their competing demands, communication may barriers may arise, um, because what does this mean? Because there's one person who wants to communicate, and there's more than one person who wants to, so it's many people want the opportunity to communicate for whatever reason, and that becomes a little bit difficult for the clear communication to happen. Lack of privacy. So a patient may hesitate to explain his or her problem. As I gave you an example, that if I'm going for a gynecological examination, this is for myself, I'm not speaking on behalf of others. I would be more comfortable if a female checks me. If, let's say, if I'm doing a pap smear, rather than a male checking me. Some people might be okay with it, I might not be, and that I call it a lack of privacy, and I'm not comfortable, so I hesitate. Language. So service users may have difficulty in expressing in a language, for instance Spanish. So you have language barriers, you have different sorts of languages, so we need interpreters in those instances. Okay, so this is why we have interpreters. um, Gender. So in certain cultures it may be difficult for females to explain their problem to male doctors. Again, these are all the factors that impact um, your proper communication. Even your dialect. So people who speak like the the Bolton language, or people from Rochdale, the way they speak, I feel it, I find it very hard to understand their dialect. Whereas if you're from London, I feel it's better understood by me, but everyone can have their own opinions about it. Poor communication skills. So, in case health and social care professionals have not developed communication skills, especially non-verbal skills, might raise a communication barrier. Now we go on to explaining or describing information handling and Um, recording procedures, sorry. So whenever we have any sort of communication, we need to document every point on within it. Okay, so if there's any communication that you've had with a patient, with your service user, you need to document it, because you need to keep a record of it if you want to use it later on, or if anyone else wants to use it later on. But how do you handle and record it? You need to keep it under with confidentiality. So confidentiality, it covers maintaining privacy and respecting wishes of the service users in health and social care settings. A service user being shared elsewhere. Okay, so for instance, if I'm taking conducting a study on domestic violence, let's say, and I'm taking the age and date of birth and personal information from a patient, they might not want their information to be disclosed in a study or in any other situation. So I'll keep them anonymous, okay, but and I'll keep a written record of them as well, and that written record will be kept in lock and key, strictly confidential from anyone else, even if they don't mention it, but you have to keep that confidentiality. Understanding of the legislation. So it is very important for us all, whoever's dealing with health and social care, to understand the legislations that are related to information and records of patients. For instance, Human Rights Act 1998 shows respect for private life and family life. The Care Act 2014, that is person-centered approach. The Health and Social Care Service and Quality Act 2015, where there's integration of information related to service users. Data Protection Act 2018, provisions related to employees and service users in a care setting. So we need to understand these legislations. Then accessing policy. So the data must be kept in at a confidential space with a well-defined access policy. Nowadays, we have online records that are maintained on storage services. So when by having an access policy, the confidentiality can be maintained. For instance, doctors may be given full access to patient records and reports, while nurses have access to certain lines of treatment or prescription. That's it. Then there's need-based sharing. So the information and the records must be shared outside the organization after you have taken consent of the patient. So if I'm publishing someone's data, or if there's a safeguarding issue somewhere, I need to make that person aware that I need to do this. Okay, so in case service users cannot understand, their family members must be consulted. For instance, if there's a child, elderly person, etc., who are not in proper senses, or they have they're suffering from mental illnesses or serious conditions, then there are other healthy family members can be contacted for that purpose. Now we go on to I'm going if I'm going a bit faster, or I'm going slow, or if I'm going okay, just please make sure that if you want more explanation on any point, just make sure we can discuss it together. Okay, if there's any question that you have, so I'm happy to have it as a two-way communication rather than just myself speaking. So confidential information about service users or patients should be treated confidentially and respectfully. So members of a care team should share confidential information when it is needed for the safe and effective care of an individual. Information that is shared for benefit of the community should be anonymized at all times. If you work in health and social care, it is important that you understand your duty of confidentiality. You must always abide by this duty, and you need to ensure that you respect your patients' and clients' legal right to privacy. What is the principle of confidentiality? It is about privacy and respecting someone's wishes. It means that professionals shouldn't share personal details about someone with others unless that person has said they can or it's absolutely necessary. Professionals in this context include people like doctors, their nurses, their social workers, support workers, and employers. In a health and social care setting, confidentiality, what will that mean when we have a health and social care setting? It means that the practitioner needs to keep a confidence. There should be a confidence maintained between themselves and the patient, and that's as good care practices. And this means that the practitioner shouldn't tell anyone what a patient has said, their other details, or anything related to that patient. They shouldn't be texting about that patient. They shouldn't be emailing about that patient without that patient's own, without their own consent. Okay. Only those who need to know about it should know about it, not everyone. What legislation covers confidentiality in health and social care? We need to know that. As I earlier said, you should know about confidentiality and about rules and laws. So, the common law of confidentiality, the principle of confidentiality is broadly taken from common law, which is why it is called a common law duty of confidentiality. It is important for encouraging people to come forward with issues and concerns. That is what confidentiality is. There are other certain offenses and provisions where the duty of confidentiality is overridden. For instance, if you're checking a girl and there's female genital mutilation, okay, it is a criminal offense. Okay, in other some countries, it is done on a quiet. Okay, so and it is you need to make appropriate authorities aware of this criminal offense. Uh, Now, some things that you need to now, for instance, if there's a person come with a nose piercing or an ear piercing, now that's their own will. But female genital mutilation is without a will mostly. Okay, so in those cases, you need to let the authorities know. Additionally, there is a serious safeguarding concern and somebody is at risk, then you have a duty to share this information to keep those people safe. Even if those people don't want it, okay, safeguarding has to be done because you're saving life there. So the Human Rights Act 1998, this gives every individual the right to respect for their private and family life. This includes having any personal information held in confidence. This right is not absolute and can be overridden if necessary, such as for a safeguarding concern. That's the Human Rights Act. Then we have the CARE Act 2014. So this encourages caregivers to take a person-centered approach when they're safeguarding vulnerable adults. It also sets out a new way of thinking in relations to adult social care by explaining the importance of sharing information at earlier stages so that people stay safe. Again, just as safeguarding. Health and Social Care Safety and Quality Act 2015. So this act is also is very important. So this sets out a number of provisions that are related to health and social care services in England. It covers the integration of information relating to users of health and social services. It also explains the sharing of information for individuals who use health and social care services. Data Protection Act 2018 and the GDPR. Very, very important, where you protect data. And we all where we work in organizations, they have the Data Protection Act and the GDPR as well. So the way organizations, charities, and businesses handle information, that is where the GDPR comes into play. And it also includes care settings, provisions relating to clients, patients, and employees. Under data protection and the GDPR, there's personal information that must be processed lawfully. fairly and transparently, so there's nothing hidden from people, from clients. B, it needs to be collected for specified, explicit, and legitimate purposes. C, it's adequate, relevant, limited to what's necessary for the purposes of why it was collected. D, it is accurate and up to date. So it's not many years back that it happened and then now you're using it. No, it needs to be accurate and up to date. Not be kept for longer than what is necessary, and processed in a manner with appropriate security, including protection against accidental loss. So sometimes the data is just destroyed. When there's no one who needs it, it's just destroyed because you don't want to keep extra data and keep saving it for later on when you think you don't need to use it. When can you break confidentiality in health and social care? Anyone? Does anyone know when can we break? I'm tired of talking. I need you all to speak up. So when can you think you could break silence or you could break confidentiality in a health and social care setting? Anyone? I'll mute myself. I'll wait for you all to speak.
When such, hello,
Yeah, I'm hearing. Yeah.
thank you. So maybe when such a thing is going to affect the clients negatively, or just in the case of like the FGM you have said, or a kind of abuse, then
Okay.
such a thing, I think is good to speak out, eh, so that such a person will be prevented from that kind of abuse.
Mm-hmm. Yeah.
So,
Brilliant.
yeah.
Mm-hmm. Yeah. Because that abuse can then later on lead to other consequences as well. And abuse happens over and over and over again. There's no stopping, and you need to put a stop to it. That is why you intervene. Yeah. Anyone else? Thank you. Anyone else?
Just to add to what the I think the other person has said, when it's going to also affect the
Mm-hmm.
whatever decision the person is making is going to be negative on the aspect of the company or
Mm-hmm.
on the staff or relatives. So it has to be spoken and broken. It has to be um,
Mm-hmm.
so spoken about.
Yes. So
Thank you.
any, yeah, thank you. So anywhere where you think that there are chances where um, there's a person who's vulnerable, um, they might be harmed or uh, um, this comes specially for those people who are most vulnerable. Okay, so to provide a simple answer, you may in certain circumstances um, override your duty of confidentiality to patients and clients. So you may break your silence if it's done to protect their best interests. So there's violence or there's neglect anywhere that's happening, and that you do this for the best interest or interests of that person or the interest of the public. Because if there's a sister, for instance, if there's a child who's been harmed, now you want to save that child, and you want to save the other siblings as well, because they might go through the same harm. So you may have information that suggests a person or a patient or a client is at risk of harm. You have information to suggest that patient or a client is posing a risk or of harm to someone else. um, in these instances, you should always report your concerns to your manager or your supervisor. You should know where to speak up. Okay, so your manager or your supervisor needs to know that. You should also help and contribute to any further actions that are taken to reduce the risk of harm. So if you're supposed to give a message, you need to do that. Okay. So consider the following scenario, which explains why overriding confidentiality is sometimes very necessary. So you're a care worker and you have gone to assist an elderly man at his home. You don't usually assist this man, but his usual care worker has gone away for a week. When you are helping him to get dressed, you notice several bruises on his back. And through his history, you know that he has no blood disorder, no bleeding disorder to have those bruises. And when you're having a conversation with him, he mentions that the nurse attacked him last week and caused the bruises, unfortunately. He believes that he said something very silly because the care worker started calling him, and that happened, they were name calling and then hitting him. You're very concerned about this man's safety when his normal care worker returns. In that instance, particularly, he tells you that he doesn't want you to tell anybody because he's scared, because the care worker is usually nice and it was just him making a silly comment that caused this to happen. He has become upset and he doesn't want to get the care worker into trouble. That happens a lot, isn't it? That person is vulnerable. Then you have children who are vulnerable, who are scared of their parents. It happens a lot. Conflict. Now, there is a clear conflict in this situation. You believe that you should inform your manager immediately and report the other member of staff. However, the gentleman has begged you not to do this because they've told you everything in confidence. So you won't want to breach his confidentiality. How do you resolve this in this situation? It is acceptable to override confidentiality. This is necessary in order to protect the man from further harm. You should explain to him that you understand why he is upset and doesn't want to speak out. However, explain that he has experienced a form of abuse and that is not right. Okay, and you need him to know that you need to save him in future instances. Here you are acting on behalf of the person's best interests and within the Public's Interest Disclosure Act. And this person, this care worker, might have access to so many other vulnerable people, vulnerable children, vulnerable adults. What about them? You've come to know about just one. How many out there might be at risk? This means you can override your duty to protect his confidentiality and speak to your manager about what you have just found out. Now we go on to evaluate the factors that can influence the maintenance of confidentiality in health and social care. There are a lot of factors. Okay, so there are 5 confidentiality rules. Number one, ask for consent to share information. When you're talking to that gentleman, he will definitely say to you no, but you have to ask for consent, that you know that yeah, consent has been given. Consider safeguarding when sharing information. Be aware of the information you have and whether it is confidential. Keep records whenever you share confidential information. Be up to date on the laws and rules surrounding confidentiality. How do you maintain confidentiality within the NHS? Confidential information about service users or patients should be treated confidentially and respectfully. Okay, so make sure every person is treated with respect. Members of a care team should share confidential information when it is needed for the safe and effective care of an individual, and information that is shared for the benefit of the community should be anonymized. Coming towards one of the last slides, for protecting confidential information, when you have regular access to such information, what should you do? You should ensure that confidential information is always locked away at night, not left unattended. If you're leaving it during the daytime, even then, you need to make sure it's locked at all times. Password protected. Protecting sensitive computer files should be there. Marking confidential information clearly as such, and ensuring that paper copies are shredded before disposal, ensuring that you only disclose confidential information to those who need to know. Uh, we go on to explain barriers to communication. We've talked a bit about them. Um, so when you have barriers, they can be overcome by checking whether it is a good time and place to communicate with the person. Always ask them, do they need another place to speak up? Do they need more privacy? Do they need someone else to be there so that they have the strength to speak up? Being clear and using language that the person understands, communicating one thing at a time so it's not very excessive information for them. Um, this is about general communication, not just for confidentiality. Checking that the person has understood you correctly. So once you've done giving information, always in between, pause and ask if you've done it correctly. Just summarize whatever you've said so far and then ask them to add on to it if they've missed out anything. Communicating in a location that is free of distractions and acknowledging any emotional responses the person has to what you have said. You could have those, so be ready for that. So a number of factors can affect, so we've seen this. Okay, so disability, you're talking to a person who has disability, hearing, they can't see properly, so you need to make sure that you try and minimize those as much as possible. Your environmental problems, so for instance, if I'm talking, I'm on the internet right now and there's a lot of background noise in my surrounding place, where I'm seated, you will not be able to understand my information. Or I had a new internet um, connection for myself when I was having internet problems here in when I was when I was teaching classes. So I had to make sure that this problem is not there. So that is also an environmental problem within the classroom, for instance, or within a hospital setting. When you're there, you need to make sure that the environment is it's well lighted, the room is well lighted, so it's presentable for the patient. It's not very hot, not very cold, it's comfortable for the patient. So these are all the environmental problems that may be there. Or it's there's a lot of noise in the surrounding and you can't communicate properly. Language differences, we've talked about this. Health problems, just like disability. Dialect, we've talked about this. In emotional distress, so if the person is emotionally distressed, you can't really communicate with them. Or even if you are emotionally distressed, it becomes hard for you to communicate. Jargons and slang and acronyms and sensory deprivation is just like disability. um, Sensory deprivation and disability. So visual and hearing impairment, this can act as a barrier to effective communication. Cash workers should be alert to additional communication needs of people with sensory impairments and disabilities. Problems when you have them with sight or hearing can mean that signs can be can't be letters, leaflets can't be read, or conversations can't be heard, for instance. And in those conditions, you have people with cerebral palsy, for instance, Down syndrome, autism. These tend to limit and communicate verbally and to interpret other people's nonverbal communication as well. Foreign language and cultural differences, you need to make sure that it's important for everyone to understand using what language you're using. And if there's a problem with that, you need to make sure that you have those messages need to be translated appropriately. You need to have a translator. Connection is unstable. Try to fix. There is a version of a language that can translate in a many people don't understand. Of sign language, slang, languages of acronyms, etc. I might understand that. However, if you say the virus, they might not understand that. Or if you tell someone that you have pyrexia is for high temperature or high fever, they won't understand. But if you say that you're that will make it. And so make sure distress and emotional difficulties is the same. So your message can't be going across effectively because of any condition being upset, health issues. So medication and operations, they may impact the person's ability to speak, ability to concentrate. Environmental problems, we've talked about all of this. And so replace for environmental think about replacing poor lighting with brighter light. Soundproofing rooms should be used, putting up multilingual posters and displaying signs clearly to help those with hearing difficulties. Care workers can make the best of care environment by by making sure they can be seen clearly by the person, make it properly lighted, making sure their mouth is visible when speaking, minimizing background noise, using eyes for expression and gestures to communicate whenever necessary. Language barriers, make sure you have preferred language which is spoken by the patient. You have those people coming in to help translate in your language. And very important, and adapt to the language needs and preferences of a person. Pace, so go slowly. As I said when I was presenting this presentation, I made sure to ask you if I'm going too fast or too slow, because you can't see me, you can't see my facial expressions. So speaking a little more slowly can help another person with a hearing or visual impairment, because you don't know what problem they're suffering from. So you need to be clear, very not very loud, but loud enough for that person to understand. Electronic devices, so you have different hearing loops, you have telephone amplifiers, text phones. You can use a lot of electronic devices that can be helpful for you to communicate. These are some of the references that you can access. So we've just done the second learning outcome, and stop sharing here. Any questions from you? Oh, there are lots of people here. I would appreciate who have come now. Can you please start writing your names in the chat box over here? This is for attendance purposes. I will start. Sorry, I went mute. I'll start sharing my second set of slides. Just give me a minute. Yeah, the deadline for submitting this assessment, just let me have a look at it. So we are doing the second learning outcome now. We're doing the third learning outcome actually. So this means third, fourth, fifth, sixth. We have 6 learning outcomes, and then we have the assignment discussion. So when we have the assignment discussion, we give you 2 weeks to submit your assessment, which means that if our session are concluding on the 11th of October, that means 2 weeks is, so you have 1 week and then 2 weeks, the 25th of October, if everything goes okay, and you submit that's when you submit your assignment. Okay, so we usually give 2 weeks for assignment submission. We give you 2 weeks to prepare your assignment and submit. After the assignment discussion session is over. I hope that's clear. The 25th of October. I'm sharing the third learning outcome. You're welcome. So yeah, I hope you can see my screen again. Now we are talking about but I mentioned unit 4. So this is unit 4 that I'm mentioning about for the assignment submission. I'm not aware of the other assignment. So I think you had mentioned somewhere assignment unit 1. I'm not sure about the other units. You'll have to email. So if you have any questions, I'm just quickly writing this. So it's
Please,
learn.
I want to say something.
Yes.
Because we are having unit 4 lectures now,
Mm-hmm.
but I haven't started. I'm just fresh in this course, and we've not done unit 1, 2, 3. So can we just do assignment based on unit 4 while unit 1, 2, 3 is still pending?
If you have any questions like these, I'm just sending you this email ID. You can see it in the chat box. It's learnerwork@ukversity.co.uk. Please contact them. Okay, so they might not be able to support you today or tomorrow, but on a Monday, when because not everyone works on weekends. It's just myself and some other colleagues who work on weekends. So they will be working on a Monday morning. So just email them and ask your questions, whatever you have. I can't say anything on behalf of them. I'm sorry. So Monday they should be able to respond to you with your with whatever queries you have. So it's learnerwork@ukversity.co.uk. Okay, so I'll start sharing my screen now. Um, so yeah, I hope you can see it. Okay, so now we are talking about Unit 4, which is working again, which is the learning outcome 3, which is to know how to reduce the spread of infection. So we know that infection spread because of so many different reasons. Okay, now we are going to learn how these are spread, these infections, and how can we limit the spread of these infections to the best of our ability. So this is when we know how they are spread, that is how we know how to limit their spread. Okay, so some of the things that we'll talk about are some infectious agents that we know of. Uh, we'll talk about harm reduction, certain other terminologies, safeguarding prevention for further outbreak, loss of reputation, illnesses, legal actions, prevention, training, monitoring, and supervision, awareness of processes and procedures, hand washing, all these processes, reporting and recording mechanisms, risk assessment, closure, initiate to initiate relevant infection prevention and control measures, recording of timeline of events, restriction of movement, harm reduction, safety, identification of risk, closure of infection areas. All of these we will be discussing one by one. I'll finish by 12 p.m. If that's okay, and whatever is left, we will continue it tomorrow if that's okay. So, what is an infectious agent or an infectious disease? So, infectious diseases, um, they're they're disorders that are caused by organisms. Mostly they're microorganisms. Micro means small. Okay, so they're mostly seen under the microscope. So they're bacteria, they're viruses, fungus, or parasites. Many organisms, they live within our body, inside our body, or on our body. It depends upon wherever they can survive. Okay, so they're normally harmless or even helpful. So some organisms within our body, for instance, in our nasal cavity, where our nose is, we have a very good bacteria there that saves us from other infections. And even in the female vaginal tract, there are bacteria that are actually harmless, or they're helpful, and they help us against certain infections. But then there are certain conditions when some organisms, microorganisms, may cause disease. Some infectious diseases may be passed from one person to another person. Okay, so they are mostly contagious. So infectious diseases commonly spread through the direct transfer of bacteria. So let's say a person sneezes, kisses someone, coughs, and to in front of a person who's not infected, the person who's not infected might catch that infection. Campylobacter infection is an example. There's hepatitis A, hepatitis B, C. B and C, they spread through a blood-borne route. So if you're having an injection, that injection is contaminated, that may carry that infection. If it has it, if the patient, if there's an already a patient that you use that needle on, let's say I have hepatitis B, for instance, God forbid, not hepatitis A, it's B and C. Uh, and I donated blood, and that blood was not screened for hepatitis B and C. When you mean, what do I mean by screening? Means it has not been assessed for hepatitis B and C presence, because they will discard that blood. They will not want hepatitis B and C positive blood. Because they don't want him to infect it into others. So if there's another person who wants that blood is shared then with that other person, and they may develop hepatitis B or C. There are also instances, for instance, if I use uh, an, um, an injection for patient with hepatitis B or C, and I get a pinprick because of that same injection, I might develop that infection then. A novel COVID-19, not spread by blood-borne route, but by sneezing, by coughing, by kissing. Influenza, measles, meningococcal disease, all of these have different routes of infection, of spread. What's the difference between a contagious or an infectious disease? So infectious diseases are caused by microorganisms, such as bacteria and or viruses, that can get into the body and cause problems. Some, but not all, infectious diseases spread directly from one person to another. Infectious diseases that spread from one person to another are known as contagious diseases. Okay, so not all infections would spread. An infectious disease will not always spread. Okay, so it has to be a contagious disease. Some infections spread from to people from animal or insect, but they're not contagious from other humans. For instance, Lyme disease, you can't catch it from someone you're hanging out with, or pass in the street. It comes only from the bite of an infected tick. So unless you've been bitten by an infected tick, you would not develop Lyme disease. Contagious diseases like flu, which is influenza, cold, or streptococcal sore throat, they spread from person to person in several ways. One way is through direct physical contact, like touching or kissing a person who is infected. Just like babies, when you kiss them, they get the infection if you're having the infection as well. Another way is when an infectious microbe travels through the air after someone nearby sneezes. So the air is full of droplets, okay, and these droplets are infectious. And if a person is close by and they get in touch with those droplets, they can also spread the infection. Um, and then there's sometimes people get contagious diseases by touching or using something an infected person has touched or used, like sharing a straw when someone who has mono, or stepping into the shower when someone has athlete's foot. You can get it very easily. Sexually transmitted diseases, or STDs, are spread through all types of sex. So you can have it through oral, anal, or vaginal sex as well. Um, the cause and spread, so there are different causes. Because of bacteria, we can have it. They're almost everywhere in our body, everywhere in our surroundings. Most bacteria live in close contact with us and our environment without causing any harm, just as I said. However, there are some bacteria that can infect the body and cause disease. So examples of bacterial diseases include streptococcal sore throat, pertussis, which is known as whooping cough. The cough comes with a whooping sound, and meningococcal disease. So this is an infection of the brain, the meninges of the layers of the brain. And viruses may only grow and reproduce inside other living cells called their host, and most viruses cannot survive for a very long time outside the human body or wherever they're living. For instance, if it's an animal body, they can't survive outside the animal body for a long time. When viruses enter our bodies, they can multiply and cause illnesses. Viruses can cause diseases such as common cold, gastroenteritis, varicella, which is chickenpox, measles, and influenza, which is the flu virus. You have fungus. They're a group of organisms that includes yeasts, molds, and mushrooms. They prefer to live in damp, warm places. Many fungi, such as edible mushrooms and baker's yeast, they're not dangerous. They're actually beneficial for us. You have Tinea corporus, which is ringworm, Tinea pedis, which is athlete's foot, and Candida, which is oral or vaginal thrush. These are all fungal related infections. Then you have protozoa, which live on moisture and often spread diseases through water. Some protozoa cause intestinal infections and they lead to diarrhea, nausea, and stomach upsets. Examples include Cryptosporidium and Giardia. They can spread through contaminated drinking water. Other causes of infection. So there are 4 other types of germs. So you may have parasites such as roundworm and hookworm, mites such as scabies, and insects such as head lice can cause infestation, and scratching may lead to secondary infections. How do these infections spread? So infections have different ways they can spread. So you can see here this table that shows you certain conditions where it is important for them to spread. You can see this table clearer over here. I'll just share this in the chat box. Just have a look at this. You can read it when you want to as well. Just save these. When I share these things on the chat box, please save them, because when the session ends, this is lost, then you won't be able to have access to it. So a harmful pathogen, there's 6 stages where there's a chain of infection. If you what we do as clinicians, we try and break that chain. So anywhere where the chain is broken, that connection between in the spread is lost, and that is when that is how prevention works. So a harmful pathogen can causes an infection. The environment allows the pathogen to multiply. Transport, then from that environment, the pathogen has to transport or to move. A route into the body allows the pathogen to enter. A route out of the body, so it has to have a place where it can enter the body. Okay, so there'll be certain organisms that can only enter through the mouth to cause infection. There are certain who enter through the skin and cause infection. Okay, so a route into the body allows the pathogen to enter. When it enters the body, that it has to exit the body to go on and infect the other person. Okay, so these are the 6 basic steps. Why is it so important? I think we will end. Oh, no, we have some more slides. Okay, these are some legislations that we can. Oh, yeah, I think I'll share these legislations for you to read up. We can discuss them tomorrow. Why is it so important? So preventing and controlling the spread of infection, because if we don't, it will become very harmful and it can become into a pandemic, just like COVID-19 happened. So there's certain steps that you need to take for stopping the spread of infection. So it's surveillance. Surveillance comes from survey. So survey is finding out new infections, isolating the patients with transmissible pathogens. So whoever are infected, you separate them from those who don't have the infection. Outbreak investigation and management, you need to have an investigation about a disease that has been just rampant and it's been out and people are being affected because of it. Education is very important. Educating yourself, educating others about it. Employee health is very important. Monitoring and management of institutional antimicrobial use and antibiotic resistance. This is important because if you have antibiotic resistance, for instance, if I'm taking antibiotics and I'm not taking them according to how I should take them, my body develops resistance against those antibiotics. And then the next time when I need to take them, the more microorganisms within my body, they're already resistant to these drugs and it won't impact them. Monitoring and management of institutional antimicrobial use and antibiotic resistance is very important. Development of infection prevention policies and interventions. Environmental hygiene is very important, and new product evaluation is very important. So all of these steps are this chain of infection we've already talked about. I will share some links with you. Please have a look at these and please read them up. And when we meet you tomorrow, because a tutor can teach you not everything in 1 hour's time. Okay, so have a look at how the infection spreads. What are the steps of infection? So a pathogen, who is a reservoir, who is the portal of exit. If you don't understand something, I will ask everyone who is in the class tomorrow. Okay, so please come after reading it. We will talk about these legislations as well. So I'm sharing pictures of them. So this is something that you could see when you come back tomorrow. We can discuss these legislations. So this I will share more. Um, Remember, these legislations, as dry as they feel, like many people don't like to read about legislations because there's a lot of terminologies and there's a lot of dates and procedures there. It's always good to know about them, because if you know them, then that is how you know how to prevent uh, people from getting infected. Um, just give me a second. Yeah, we will do how to stop infections tomorrow. Because I think we're running out of time. I'll just quickly take your attendance. Please make sure to come having read these legislations, and also how do infections spread. I will stop the recording.